So we're in the Eastern Market,
Yes.
and you chose this location, right?
I did.
personal meaning?
Love Eastern Market.
Yeah.
We come here almost every Saturday.
Wow.
But part of the reason why Eastern Market is so special to me is when we first moved to Detroit from Chicago, it was the summer of COVID, right? That
right.
very first summer, full summer, and everything was closed. There was no place to go. And think about when you move to a new city, part of what you love is exploring places, right? Restaurants and museums. None of those places were open or available to us, but Eastern Market was, and it stayed open the whole time. But it was a place where we could go. You felt like you were a part of a community. And for us, for my family, my kids and I, like, this is a really special place, I think, because it was one of the first places that we discovered and connected to when we moved here.
Heather Geisler, our Chief Marketing, Communications, and Experience Officer. It's a lot kind of in one job title, but there's so many different facets to your role. Can you maybe just start us off and tell us a little bit about your job? What do you do at Henry Ford?
Yeah, it's such an amazing job. And I have to tell you, when I first got this job or started considering this job 2 years ago, one of the things that I loved about this job was the fact that it did include a focus on our brand and our marketing. How do we make sure that people understand what makes Henry Ford a special place? Communications, which is so critical in healthcare, never been more important, both inside and outside the organization, as we've learned so acutely going through COVID, how important information and access to information is. And then the experience piece. How are we really making sure that we're meeting and exceeding those expectations? And so the ability to have a role where you can really impact the end-to-end healthcare journey for those that we serve was tremendous and very exciting.
I feel like you also get a glimpse into what this looked like maybe 50 years ago, 100 years ago.
Well, and the idea that it's a tradition and a place where people have come together for so long, I think that's part of what makes it a place that people keep coming back to.
Similar in a sense to Henry Ford Health almost, right? Like another anchor place in Detroit, another anchor institution, an organization that has such a great history, reputation, you know, some similarities there.
And connected to generations of families, right? And there's a similar idea when you come to a place like this, is that people have memories of coming there with their parents or their grandparents. And at Henry Ford, you know, we talk about Henry Ford being like family. We've taken care of families and generations who have been in Detroit for years, and that's a really important part of what makes Henry Ford so meaningful for so many people.
So Heather, how did you get here? Kind of walk me through your trajectory that led you to Henry Ford.
Yeah, I have a very eclectic background. My entire career has been spent in marketing and communications and creating experience, but I've done it for lots of different industries, lots of different organizations, and lots of different sectors. So I actually started working at agencies for a number of years. I worked for, you know, high-profile individuals. So for example, I worked for First Lady Michelle Obama around her Let's Move initiative. So lots of things connected to the healthcare and public health space, but not necessarily in a health system. I also worked in media for a number of years in New York at MSNBC, the cable network, really helping them think about what that brand could or should be and how they could change the relationship with their viewers. And then I went and worked at Hyatt Hotels Corporation. So I was creating branded experiences across 18 different hotel brands all over the world. And so it really is at the core of everything I've done in my career has been about meaning and purpose and mission. I've been lucky enough to work for organizations for whom that's been very important and for whom their brand and those experiences really become the greatest expression of that mission and purpose. And so looking at healthcare in particular during COVID, in particular in a place like Detroit, in particular at a storied institution with such a strong brand like Henry Ford, was a tremendous opportunity.
Wow, this is super cool. So are you really into public arts? You know, is this sort of your aesthetic?
Yeah, well, and I feel like I do, and I feel like this is so Detroit though too, right? I mean, the fact that there are spaces that have transformed as the city has transformed, and you know, I think it's really interesting because public art is about expression. It's also reflective of the community, who you are and who you want to be. So I think one of the things that's so amazing about the murals in Detroit is how they're used as canvases to express what's important to communities, but also really important canvases for advocacy, you know, and you see a lot of really important messages about engagement and voting and like the social issues that really have an opportunity to change communities. One of the things I love about Henry Ford is how engaged we are in public art and supporting the arts and the connection between art and community and healing. And you know, there's no shortage of really amazing, engaging public art spaces in Detroit.
What are you most proud of here at Henry Ford Health?
I would say I am incredibly proud of the brand work that we did on the repositioning of the brand. When I look back on that, and I am proud of it, but I am proud for what we as an organization have accomplished through that. It took a long time. It was the effort of the organization to really align behind that new brand promise of being your relentless advocate and making the impossible possible, and opening their hearts and minds to the idea that we could or be something different, in embracing what it means to be I Am Henry, and really leaning into those stories and that kind of sense of connection, community, of that shared vision for who we could and should be. That's something I'm incredibly proud of.
You know, I think a lot of people would have some interest in this, but you know, how do you, Heather, see the future of healthcare from your, you know, very unique perspective that you bring?
Yeah, I think it's so interesting because I do think we're seeing this tremendous rise in consumerism in healthcare, right? The emergent healthcare players are retail brands, they're technology companies. They're organizations who are taking data and insights and understandings about what consumers expect from an experience. And I think that they are setting the pace and they're reframing the expectations. And I think that is both a challenge for us, especially when you have a large institution that's so storied and established, is how do you make those pivots in the right areas that allow you to be responsive to those needs while still staying core to what makes you different and unique. So I think that's a tremendous opportunity.
Do you guys only come for the market, or do you come downtown for other stuff too?
Oh yeah, no. We love to go to the museums. We love coming down for sporting events. So especially with a 12-year-old son, we go to Tigers games and Pistons games, and I love Detroit style pizza. So good. Love it, love it, love it. I sing its praises high and low, even back in Chicago with my family. So Detroit style pizza, I didn't even know it existed really until I moved here.
So good.
And it is a thing, and a thing worthy of celebration. And so, like, yes, we are big pizza fans for sure.
This is a Women in Leadership series. What would be your advice to women of any age, women that are coming up in their careers, women that are looking back at their careers? What would you say to a young woman, you know, who's wondering where their path is in life and where they're going, and what would you tell them?
When people ask me about my personal brand, I say that this is my motto, and my motto is never settle. And so I think for a young woman who's coming up and finding her path and forging her way, this idea of never settling, right? You know, for so long, and that doesn't mean that you don't detour, and it doesn't mean that you don't downshift, but it's entirely self-directed, right? Settling says that you're resigning yourself to something you can't control or you can't change. And I would hope that when I think about my younger self and I think about other young women that are coming in, to really claim your power, and in that way don't settle to let things happen to you. I do think consistent across my career, and this is true to who I was at 18 and true to who I am today, my work is incredibly personal to me. I feel a high personal connection between my personal values and the work that I do. And part of that never settling was always making sure that I was working in a place or on a brand or with an organization for whom I had a meaningful personal connection and was aligned with my personal values. And as you know, windy as my personal path has been, I do think that that's been something that's been consistent across my career.
Heather Geisler, our Executive Vice President, Chief Marketing, Communications, and Experience Officer, thank you so much for the conversation and the insight. We appreciate you so much.
Thank you, Lauren. It was so great chatting with you.
You too.
And they have really good agua frescas.
Oh, delish.
It's delish.
I need some more chata.
We really like, oh, it's my favorite. It's
my favorite
the
too.
weirdest thing. It's
So
like liquid
good.
rice pudding.
Liquid rice pudding. And so bad for you, but so good.
Oh, you didn't have to say that.
Oh, it's not that bad for you. It's totally like no calories at all. There's nothing bad in it at all.